Miss Fallon Perkins, Jeff, if you could find her, she's our great friend and business partner. She's going to talk about her experience as a mother, being an impact member, and going through the process of having a child, some really remarkable air, flight, the whole deal. And we have some examples of bills that she'll walk through in her own example. And Fallon, we're so glad to have you on here today. Now, Fallon, is a full disclosure, was a student of my wife. My wife is a high school teacher. Fallon was one of her prize students. And so we're excited to not only be friends, but also former students and teachers of her. Now we get to build a business together. So, Fallon, thank you for being willing to share your experience with Impact, how this worked, and how it worked for you in the process of your child.
Yeah, thank you for having me. It's just so exciting having impact for so many reasons. I saw this product first like 4 years ago, and it was just me and my husband, and we knew we were gonna have kids. So we, of course, picked the $2,500 PRA because we were like, it's gonna happen soon. Um, and I'm a little bit older, and my husband's a little bit wanderlust. So we had kind of an interesting journey through maternity care, trying to find providers as we traveled around the US, figuring out where we would live. And Impact was seamless the entire time. They didn't care which providers we saw, as long as they were licensed in that state. They were happy to negotiate our bills and manage that. We ended up settling in Montana for our first baby. And like he said, we had some excitement. We had emergency surgery for me. Um, she ended up with an air flight. So Melissa mentioned air flights are covered. So my daughter was air flighted about 3 hours away to a NICU hospital. Thankfully, she was released rather quickly in about 5 days and is completely healthy now. But as you can imagine, those added up to some pretty significant bills. Um, I believe the Ryan may have the pricing there. Let me see if I can tell which one that is. Yeah, that one looks like it is the air ambulance. And they originally billed out over $30,000 and ended up we paid 1,600, and they repriced it down to like 14,000. So it was less than half the original bill. And our total billing for our birth was close to $100,000. Um, we were around 95, 93,000. Yeah. So my in-laws, actually, my sister-in-law had a baby about 6 weeks prior to us in a totally different state. Hers was very uncomplicated, just normal, healthy birth. And as you can see for hers, she's the pink line. Hers was about 57,000. And we ended up paying less than half of what they did out of pocket because of the reference based repricing that we got. Um, it just made us feel so much better to know that Impact was in our corner, that we didn't have to pay out of network fees if, we had no idea she'd be transferred to another hospital. So we couldn't have known that. And if it had have been out of network, I'm sure our costs would have been significantly higher. Um, and then on top of that, our hospital system where she was born was unfortunately not the best at dealing with impact. Um, but impact has just stayed the course the entire way. They have fought every bill for me, so I didn't have to go in and deal with it while I was trying to heal and take care of a new baby. It's just been the most amazing peace of mind for going through these big life changes.
Fallon, your experience is so remarkable. And what a great testament to understanding a term that Melissa's used multiple times. She talked about member centric. See, Impact's goal and objective is to treat people like people, not like a business and not like a number. And that's where Impact really separates itself. Now, is Impact perfect? No, there is no such thing as perfect. But they certainly pride themselves on trying to provide people access to heal and to provide for their at care needs. Now, again, when I hope, and I'm leaving this slide up so everyone can understand what she talked about. We're talking about a side by side cost comparison between one individual with a massive, arguably the largest healthcare provider insurance company in pink, BCBS, Blue Cross Blue fill in the blank. That's the largest healthcare provider with real insurance. This is the thing people always talk about. Well, I have real insurance. Well, this is really good healthcare, but not insurance. But let's look at the side by side. Number one, because of the complications of your particular situation, Fallon, your outstanding original bill was nearly double what the beginning point was of your sister-in-law. So we have a starting point of where the cost regarding the care was nearly double. Then we talk about reference-based repricing. Now you'll notice that the Blue Cross Blue Shield doesn't have to do reference-based repricing because they have what are called contracted rates. So there wouldn't be a number there. Impact goes through the process of price negotiation. Then it goes to what did the provider pay? And then what did the Perkins be responsible for paying? And when you understand a normal insurance family will spend about $5,000 for an individual deductible and a household deductible of $10,000, you'll now know why her sister-in-law paid a $14,000 out-of-pocket expenses because the family deductible was probably $10,000 and they had something called co-insurance after they met their deductible. So you'll see why side by side, even though you may compare impact to a regular individual, we're better off. Like Impact really is a phenomenal service and it provides fantastic care. So Fallon, thank you very much for sharing your own testimonial about how Impact is working, how they continue to be there for you and allow them to do the heavy lifting of contracting and dealing with the hospitals and dealing with that kind of process. And yes, there's some process for us to do on the back end, but ultimately Impact is a phenomenal, phenomenal system.